First of all, my name is Steve Coe, and I'm the Organising Director for TSSA, responsible for health and safety at national level. And joining me today is David Hardman, who is TSSA's Health and Safety Rep. He works for RSSB, which is the rail industry's safety and standards body. David is also, as it happens, chair of TSSA's National Health and Safety Steering Committee. And we're here today to talk about risk assessment. David, we often hear about risk in our daily lives, usually in connection with either finance, often, or health and safety at work, of course. Well, what exactly do we mean by risk in the context of health and safety in the workplace?
Okay, hi Steve, and hello everybody. So risk, really, when we're talking about risk, what we mean is the possibility or the probability of something bad happening. From a health and safety perspective, of course, what we're really concerned with is the possibility of someone being injured through the course of their work, or of somebody being made ill by their work, or having an existing condition aggravated by their work. So again, simply really the possibility or probability of someone being harmed. In order to assess risk, it's necessary to consider who is at risk of being harmed, what's the likelihood of harm occurring, and what is the likely severity of harm if it does occur. Okay,
thanks, David. Obviously, we don't want people harmed in the course of their work, that's obvious. So what actually is a risk assessment?
So risk assessment is a systematic examination of a task, of a job, or a process carried out at work with the purpose of identifying the significant hazards and the possibility or probability of someone being harmed by those hazards. Having done that, the person carrying out the risk assessment should then consider what is in place in order to reduce the risks. So this is what we refer to as control measures, and to identify what further control measures might be necessary. And the aim, of course, should be to control the risks to the point that they've actually been completely eliminated.
David, you mentioned hazards there. Just so that we're clear, what exactly is a hazard?
So a hazard basically is anything that could cause harm, anything really that could cause injury or that could damage a person's health. And these include biological hazards. So, at the moment, COVID-19 is what we would consider to be a biological hazard. Typical hazards in an office environment, offices, of course, are often seen as safe places to work, but they include things like the ergonomic hazards associated with computer technology and indeed your desk setup. So people do sometimes get musculoskeletal disorders just by having a bad setup at their desk. Also, slipping and tripping hazards are common in nearly all workplaces, as are electrical hazards. And of course, as we know, as we're increasingly recognising, workload pressures are another hazard. Workload pressures can increase stress, leading to both mental and physical ill health. And these are all hazards which need to be controlled.
So who is responsible for carrying out the risk assessments?
So that is the employer's job. The employer is required by law to protect both their employees and others from harm. This is part of the 1999 regulations, the Management of Health and Safety at Work regulations, which require employers to identify hazards and to carry out appropriate risk assessments. And the employer must appoint a competent person in order to carry out the risk assessment. In other words, someone with the necessary skills, knowledge and experience.
So presumably that can be somebody who's actually an employee of the employer concerned, but I also think that you can bring somebody in from outside, an employer can bring somebody in from outside as well.
Yes, that's right. Provided they're a competent person. Indeed, where I work at RSSB, our competent person at the moment is someone, sort of that we've sort of brought in from outside. It's important also to note that health and safety reps themselves should not be carrying out risk assessments. That's not their job. That is the employer's job. The employer must consult health and safety reps. That is also sort of part of the employer's legal obligations, but it is the employer's job to actually do the risk assessment.
Well, it's obviously clearly not possible to completely eliminate risk in the workplace. And I think as an example of that, many TSSA members drive road vehicles as part of their jobs, which is probably the most hazardous work undertaken by any of them these days. And some of our members work on railway tracks where they're removing trains.
Yeah, so basically, if a risk can't be eliminated, then the law requires that employers control that risk to an acceptable level. And there is a hierarchy of control measures which have to be considered. So the first of that hierarchy is to ask whether the actual task can be eliminated. Obviously, it's necessary, for example, for some people to use travel in, to travel in road vehicles in order to get to work or for part of their work. But is that really the case? Is it possible that people could actually avoid travelling by using video conferencing, for example, or doing their task remotely in some way? That's what we refer to as elimination.
So if a risk can't be eliminated, what then?
So the next step down that hierarchy is what we refer to as substitution. For example, taking that travel example again, could the employer use a safer means of travel, such as using a bus or train instead of travelling in a car? If it is still necessary to use a road vehicle, then the next control measure is to consider engineering controls. So we might ask, is the vehicle the safest one available for that journey? Is it properly equipped? Is it regularly maintained? And going down that hierarchy, that we then come to administrative controls. Is the employee competent to drive that sort of vehicle? Are employees required to inspect the vehicle before use? Are they required to comply with speed limits? Are they prohibited from using mobile phones whilst moving? Could the journey be made by a safer route or at a less busy time? So having process and procedures in place that require proper planning of work is also an important control measure in so many instances. That's why planning is so important in ensuring the safety of those working on the rail tracks. If the hierarchy of control is gone through and a risk is still not as low as reasonably practicable, then personal protective equipment, or PPE, should be considered. So you can see that on the diagram at the screen, right at the bottom of that inverse triangle. So that's the last line of defence against harm. It's why track workers wear orange high-vis clothing and hard hats, so that they can be more easily seen and worn by approaching trains. It's why people working on track renewals where ballast is tipped, generating large amounts of harmful silica dust, wear respirators in order to prevent lung disease.
You mentioned an important phrase there, David, as low as reasonably practicable. What does that actually mean?
Yeah, so there's not a hard and fast definition of this. The law does require employers to reduce risks to the lowest level possible, but at the same time, they're not expected to spend disproportionate amounts of time or spend ridiculous amounts of money in order to do so. So in other words, what is considered to be reasonably practicable is a little bit of a grey area, and that's often where you get the most heated debate between health and safety reps on the one hand and employers.
Yes, that's very true. Okay, so we've established that an employer must, by law, protect their members from harm. They must, by law, appoint a competent person to identify the hazards in the workplace and carry out a risk assessment. They must, by law, ensure that person applies a hierarchy of controls to either eliminate the risk or to apply controls in order of priority in order to reduce the risks to an acceptable level, as we've said, as low as reasonably practicable. So how should the risk assessment be carried out, David?
So the basic idea of risk assessment is that it's actually a structured approach to sort of tasks and jobs in the workplace, and going through this structured risk assessment, you record the various hazards and control measures that you identify. So a risk assessment template is often used to record various items, and these might include who might be harmed and how might that occur, what is already being done in order to control the risk, what further action is needed to control the risk so that it's acceptable, and who needs to carry out those actions and what is the deadline for actually doing that. So, as I mentioned earlier, it's necessary to assess both the likelihood of harm occurring through some hazard and the severity of the harm that might actually occur. And what is often used is a risk assessment matrix, which has harm on one axis and increasing harm on one axis and increasing severity on the other. Sorry, let me say that again. So increasing likelihood of harm on one axis and increasing severity of harm on the other axis. Typically, what is used is a 5x5 matrix, which is what we've got on the screen there. And there's kind of traffic light system, as you can see, where certain combinations of likelihood and severity lead to an increasing estimation of the overall risk. The matrix allows you to score each hazard and gives a much clearer picture of whether or not risks are acceptable, both before and after control measures have been implemented, and also to identify what are the priorities for the risks to be tackled. Although numbers are actually used in this process, it's not an exact science because it does rely on people's judgments as to the likelihood and the severity. So there's elements of subjectivity in that respect. And of course, this means that a health and safety rep's perception of risk might be somewhat different to that of the person actually undertaking the risk assessment. And finally, it's also the case that although we're looking at a 5x5 matrix there, some employers might use a different matrix. So, for example, a 10x10 matrix.
Okay, so where do health and safety reps, TSSA health and safety reps, come into the process then?
So, as I mentioned earlier, it is a legal obligation upon the employer that they must consult on the risk assessment with TSSA Health and Safety Reps, and they should take on board their views. And of course, the reps themselves need to consult their members and take their views on board before the risk assessment is finalised.
Okay, so once the competent person has completed their draft risk assessment, it should be discussed with the TSSA Health and Safety Reps, right?
Absolutely, yeah. So that is what the law requires. But it's also worth noting that best practice is for the competent person to involve the TSSA Health and Safety Rep in a collaborative approach from the outset, rather than simply sort of the employer doing the risk assessment and then saying to the rep, here you are, what do you think? So it's much better for the rep to be involved right at the outset of the whole process. And again, that the rep themselves involves their union members in that process. That's the best way of ensuring that all relevant information and factors are considered.
Yeah, I mean, I know from my experience that not all employers believe in collaboration. Some even try to avoid consulting TSSA Health and Safety Reps by consulting, say, another union's health and safety reps instead.
Yeah, well, we all know, some employers, of course, are better than others. Some are worse than others, but it's not acceptable. What you're describing there. The employers must at least consult with the relevant TSSA Health and Safety Reps, and I would always urge, the reps themselves to be pretty bold in actually, holding their employer to account. So, it's not necessary to be, particularly aggressive towards the employer in all circumstances. But if your employer is not actually holding up their side of the bargain, then you really do need to actually tackle them and say, look, you need to be talking to us. Let's get around the table.
Absolutely, David. And in my view, I mean, consultation on risk assessments, like any consultation, clearly needs to be meaningful. And in that sense, the same approach should be taken to consultation on risk assessments as is taken as we would expect an employer to take with any other consultation discussion with TSSA reps. What that means is that TSSA reps are given the documentation in good time to allow them to properly consider and analyse the information and data provided, and of course, and most importantly, to consult with their affected members. And I would normally expect good time to be at least about a week before a formal consultation meeting takes place that is recorded or minuted. And I think reps should remember this is consultation, so the employer does not need the agreement of a TSSA Health and Safety Rep in order to implement. However, the TSSA Rep should seek guidance from their union organiser should there be a failure to agree, and consideration should be given by the Rep to referring the matter of disagreement up to the next level of the procedures.
And it's also the case, of course, that any risk assessment should be revisited and reviewed with the TSSA Health and Safety Rep if circumstances change, such that this might actually affect the risk being assessed. So the risk assessment should, in any case, actually have an agreed date for a joint review between the employer and the union.
Yeah, that's a good point. David, some local TSSA Health and Safety Reps complain that they are told the risk assessment has been undertaken at company or national level, but it doesn't take into account local circumstances.
Yeah, so the employer can conduct generic risk assessments relating, for example, to the use of a ticket machine across the company, and that's often sensible. They must still, of course, consult with the relevant TSSA Health and Safety Reps, normally at company level. And those company level reps should consult with local health and safety reps and members before having discussions with the management. But if there are particular local circumstances that apply, then the employer must conduct a local risk assessment and consult with the local health and safety reps.
Okay, so it's obviously important that TSSA Health and Safety Reps work as part of the team with other TSSA reps when they're considering these risk assessments. It's really important that they make sure that all the relevant reps are involved. David, have you got any other points to add?
Well, I would just say that it is important to remember that in controlling one particular risk, it's important that you don't inadvertently create or increase another kind of risk. So again, it's really important that TSSA Health and Safety Reps watch out for that when they're considering the risk assessments.
Okay, so David, we've established that TSSA Health and Safety Reps must by law be consulted on risk assessments, that it's preferable that health and safety reps are involved in the drawing up of risk assessments, that consultation on risk assessments should be formal and recorded with documentation provided in good time before the meeting, that risk assessments should be regularly reviewed and reviewed if circumstances change, and most importantly, TSSA Health and Safety Reps should involve their members and the other reps in their team in the consultation process. And I would remind everybody who's a rep, particularly a health and safety rep, that the TSSA website has much more information and resources that you can draw upon and use. David, thanks very much for that discussion, and we'll throw it open now to questions.
Okay, thanks, Steve.